Hi, my name is David. I'm a pharmacist, and I'd like to talk to you today about vaccinating different populations. Now let's talk specifically now about older adults. Now the term older adults has evolved over time, particularly with regard to reductions that we've seen in cutoff age ranges for eligibility for certain vaccines. One of the most notable recent examples of this was pneumococcal vaccine. But what I will say about patient age is it's probably the easiest mechanism to identify patients who would be indicated for certain vaccines. So the big age cutoffs to remember would be age 50 years and older, age 60 years and older, age 65 years and older, and age 75 years and older. So for patients who are age 50 years and older, all of these patients in these age groups should receive at least one dose of pneumococcal conjugate vaccine. Now, which vaccine is indicated specifically will depend on the patient's prior pneumococcal vaccination history, and that can be difficult to remember at times. So I would highly recommend consulting with the CDC's website. They have great resources, including their Pneumorex Advisor that is available both as a mobile app as well as an interactive online resource that can provide some guidance with regard to which vaccines a patient should be eligible for based on their history, their age, and other types of factors. Additionally, for patients in this age group of 50 and older should receive a 2-dose series of the Shingrix vaccine. Now, this is the newer recombinant shingles vaccine. And importantly, prior receipt of the former version of this vaccine, Zostavax, is no longer considered adequate. And I would highly recommend talking to your patients about this and possibly even utilizing other resources like immunization registries because patients may not always remember what type of zoster vaccine they received in the past. There's also some emerging data suggesting that Shingrix actually will delay certain neurologic diseases like Alzheimer's, which is very exciting. So moving on now to the age 60-year and older group. For this group, there is a conditional recommendation for RSV vaccine. So patients 60 years and older, if they have certain chronic comorbidities like chronic heart disease, chronic liver disease, lung disease, or diabetes, would be indicated for an RSV vaccine. Additionally, if they reside in a nursing home as well. Now, this is a conditional recommendation, but as I'm sure you know, sometimes the majority of patients in this age group have at least one of these conditions, and so you can bet that the majority of the patients that you talk to in this age range will actually end up being indicated for an RSV vaccine. So the next group to think about is 65 years and older, and this is related to respiratory virus vaccines. Patients that are 65 years and older who are receiving influenza vaccine should actually preferentially receive an enhanced influenza vaccine. Examples include high-dose, adjuvanted or recombinant flu vaccines, and they should also receive a second dose of their COVID vaccine after 6 months from their initial dose. So moving on now to the final group of 75 years and older. In this age group, as opposed to the 60 years and older where there was a conditional recommendation for RSV vaccine based on comorbidity, in this age group, anyone who is 75 years and older should receive an RSV vaccine dose regardless of comorbidity. And currently, RSV vaccine doses are limited to one lifetime dose. It's also important for all age ranges to think about routine vaccinations like annual flu, COVID, as well as Tdap every 10 years. So those are major considerations to think about when vaccinating older adults.